Don't miss these 10 early diabetes signs. It could save you. Some of these symptoms may surprise you, but recognizing them now can help you take control of your health before it's too late. Stick with us until the end because understanding these signs might just save your life. Number 1. Frequent urination and thirst. We've all woken up in the middle of the night to grab a glass of water or use the bathroom, but when this happens frequently, it could be a subtle sign that something's off with your blood sugar. Elevated blood sugar levels force the kidneys to work over time to filter excess glucose, which leads to frequent urination, a condition known as pora. As the body flushes out that extra sugar, it also takes a lot of water with it, leaving you dehydrated and feeling parched. This constant cycle of drinking and bathroom trips can mess with your sleep and leave you tired during the day. If you find yourself unusually thirsty or making more bathroom trips than usual, take it as your body waving a red flag. Start by monitoring your blood sugar regularly, especially before bedtime, and talk with your healthcare provider about what might be going on. It's also a good idea to stay hydrated during the day to help your body function smoothly, but go easy on water intake close to bedtime. Small changes like reducing sugary drinks and eating balanced fiber meals can go a long way in stabilizing blood sugar. For older adults managing diabetes, keeping an eye on thirst and bathroom habits is crucial. Left unchecked, these signs can lead to further complications like dehydration, fatigue, or even kidney stress. But here's the good news: being aware of these subtle changes puts you back in the driver's seat. By taking action, whether through monitoring diet or lifestyle tweaks, you can improve your sleep and stay ahead of diabetes-related challenges. Number 2. Skin signs. Have you ever noticed dark velvety patches of skin around your neck, armpits, or even the groin area? While it might look harmless, this skin change, known as acanthosis nigricans, can actually be a red flag for insulin resistance. Insulin is supposed to help move sugar from your blood into your cells, but when your body starts resisting its effects, insulin levels build up. High insulin then triggers skin cells to grow more rapidly, particularly in areas where skin rubs together like the neck and underarms. The result: those patches that might look like dirt or pigmentation are actually early warning signs that your body isn't processing sugar properly. If you spot this, don't brush it off. Instead, consider it an opportunity to take charge of your health. Managing insulin resistance through diet, exercise, and regular blood sugar monitoring can stop these patches from getting worse and, more importantly, prevent prediabetes or type 2 diabetes from progressing. To keep your skin and overall health in check, focus on small, actionable steps. Swap out sugary snacks for whole foods like leafy greens, healthy fats, and lean proteins. Simple exercises such as brisk walking or light strength training can also improve your body sensitivity to insulin. These lifestyle changes aren't just about looking better, they're about feeling better and taking the power back from diabetes one step at a time. Number 3. Skin tags. Skin tags might seem like nothing more than harmless little growths, but they can also be a sneaky signal of insulin resistance. These soft flesh-colored flaps often show up in areas where skin folds together like the neck, armpits, or groin. If you've noticed several skin tags appearing seemingly out of nowhere, it's time to pay attention. High insulin levels can stimulate the skin to grow faster, leading to the formation of these tags. It's your body's subtle way of saying, hey, something's not right here. So what can you do? First, don't panic. Skin tags themselves are harmless and common, especially as we age. However, their presence can be a clue that your blood sugar isn't under control. It's a good idea to check in with your doctor and discuss testing for insulin resistance or pre-diabetes. Catching it early gives you the chance to make changes that can prevent type 2 diabetes and its complications. The good news is managing your blood sugar doesn't have to be overwhelming. Focus on eating balanced meals with fiber, vegetables, healthy fats, and lean proteins. Cutting back on processed foods and sugary drinks can go a long way to pair that with a little daily movement like a short walk after dinner, and you'll be on your way to better health. Small steps matter, and noticing something as simple as skin tags could be the wake-up call your body needs. Number 4. Recurring infections. Ever feel like you're dealing with one infection after another, whether it's a stubborn urinary tract infection, UTI, a nagging yeast infection, or skin issues that just won't go away? This could be more than just bad luck. Diabetes, particularly when blood sugar levels are high, creates the perfect breeding ground for bacteria and fungi. High sugar in the blood and even in your urine acts as fuel, allowing these organisms to thrive and spread. Combine that with a weakened immune system caused by diabetes and your body struggles to fight off Infections effectively. If you've noticed frequent infections, it's important to connect the dots. Recurring UTI, yeast infections, or skin abscesses could all be signs that your blood sugar is out of balance. Ignoring these infections isn't just uncomfortable, it can lead to more serious complications if left untreated. Reach out to your healthcare provider to discuss your symptoms and get tested for diabetes or insulin resistance. It's a proactive step that can help you stop infections in their tracks while protecting your overall health. The best defense: stabilizing your blood sugar. Through simple lifestyle changes, focus on eating fewer processed foods and refined sugars while adding more whole nutrient DSE options like vegetables, lean proteins, and healthy fats. Hydration is key too. Water helps your body flush out excess glucose naturally. Small habits like a daily 20-minute walk or checking your blood sugar regularly can strengthen your immune system and help you feel your best. Your body has an incredible ability to recover. Give it the tools it needs. Number 5. Diabetic stiff hand syndrome. Have you ever tried to press your palms together like you're about to pray, only to realize your fingers won't fully straighten or your palms can't touch? This isn't just stiffness, it could be a sign of diabetic stiff hand syndrome, also known as diabetic chiroarthropathy. It happens when prolonged high blood sugar causes sugars to bind to proteins in your skin and tendons in a process called glycosylation. Over time, this makes the soft tissues thick and less flexible, limiting the range of motion in your hands. While this condition isn't painful at first, it can become more restrictive if left unchecked, impacting your ability to grip objects, type, or perform daily tasks. Many people mistake it for arthritis, but unlike arthritis, this stiffness isn't caused by joint damage. If you're experiencing symptoms like a positive prayer sign where your hands won't fully close or straighten, it's a good idea to have your blood sugar levels evaluated. Recognizing this early is key to avoiding further complications. The best way to tackle diabetic stiff hand syndrome: focus on keeping your blood sugar within a healthy range through a combination of balanced nutrition, regular exercise, and consistent monitoring. Simple hand stretches and exercises like opening and closing your fingers or pressing them against a flat surface can help maintain flexibility. Remember, addressing your blood sugar doesn't just protect your hands, it helps your entire body function at its best. Small mindful actions today can lead to a stronger, more capable tomorrow. Number 6. Trigger finger and frozen shoulder. Sometimes your body gives you subtle hints that things aren't quite right, like when a finger feels stuck in place or your shoulder refuses to move without pain. These issues, known as trigger finger and frozen shoulder, can be more than just occasional stiffness in people with diabetes. High blood sugar causes thickening and inflammation in the tendons and surrounding tissues, making movement difficult. Over time, it can feel like your joints are locked up, causing discomfort and limiting your ability to perform simple tasks. With trigger finger, you may notice one or more fingers snapping or catching as you try to straighten them. You might even feel a small tender lump at the base of the affected finger. On the other hand, frozen shoulder can make it painful to lift, rotate, or even reach behind you, significantly affecting your daily life. Both conditions are surprisingly common in people managing diabetes, but they often go overlooked until the symptoms worsen. The good news: early intervention makes a big difference. Start with gentle stretching exercises to maintain mobility and focus on managing your blood sugar levels to reduce inflammation. If the stiffness persists, talk to your doctor about treatment options like physical therapy or anti-inflammatory solutions. Addressing these signs early means you can regain flexibility, reduce pain, and keep moving with confidence. Number 7. Neuropathy and foot damage. One of the most overlooked signs of diabetes starts with a tingling sensation or a feeling like you're walking on cotton. This is often the first hint of neuropathy or nerve damage caused by high blood sugar. Over time, the nerves, especially in your feet and hands, can become so damaged that you lose the ability to feel pain, heat, or even injuries. While it might seem harmless at first, this loss of sensation means cuts, blisters, or small wounds can go unnoticed, leading to serious complications like ulcers and infections. Diabetic foot damage doesn't stop there. Poor circulation caused by diabetes makes it harder for injuries to heal properly. Without intervention, these untreated wounds can progress into severe infections and in extreme cases lead to SHCO, foot, or even amputations. It's a sobering reality, but one that's preventable if you stay proactive about foot care and blood sugar management. Protecting your feet starts with simple daily habits. Check them every day for any cuts, swelling, or changes in color, and wear comfortable, well-fitted shoes that prevent injury. Keep your blood sugar levels in check to protect your nerves and improve circulation. If you notice any issues like persistent Numbness, sores that won't heal, or changes in foot shape. See your doctor immediately. Taking care of your feet isn't just about comfort, it's about safeguarding your independence and overall health. Number 8. Severe infections and amputations. When it comes to diabetes, even a small cut or blister can turn into something serious. High blood sugar weakens your immune system and reduces blood flow, making it harder for your body to heal injuries, especially on your feet. Over time, untreated wounds can develop into severe infections which can spread to the bone and surrounding tissues. This is where things get dangerous, as infections that don't heal can lead to amputation, a last resort step to stop the infection from spreading further. It's a frightening outcome, but it doesn't happen overnight. The signs often start small: redness, swelling, or a wound that doesn't improve with time. Unfortunately, nerve damage, neuropathy, can make it difficult to feel these injuries, so by the time they're noticed, the infection has already advanced. That's why daily foot checks and consistent blood sugar management are essential for anyone managing diabetes. Catching small issues early can prevent them from turning into life-changing complications. Here's how to stay ahead. Make it a habit to inspect your feet every day. Look for cuts, bruises, or changes in skin color, and don't ignore anything unusual. Keep your blood sugar in a healthy range to help your immune system fight infections and improve circulation. If you spot a problem, see your doctor right away. Even a minor infection deserves immediate attention. Taking care of your feet today ensures you can stay active, healthy, and in control of your future. Number 9. Gastroparesis. Have you ever felt full for hours after a small meal, or dealt with persistent bloating, nausea, or vomiting? This could be a sign of gastroparesis, a condition where the stomach takes far too long to empty its contents. For people with diabetes, high blood sugar can damage the vagus nerve, which controls the muscles in the stomach. When this nerve doesn't work properly, digestion slows down, causing unpredictable and uncomfortable symptoms. The problem doesn't stop there. Gastroparesis can lead to erratic blood sugar levels as your body absorbs carbohydrates unpredictably. One meal might sit in your stomach for hours, causing a delayed rise in blood sugar, while other times digestion may speed up without warning. This roller coaster effect makes managing diabetes even trickier and can leave you feeling frustrated and unwell. Managing gastroparesis starts with small, simple changes. Try eating smaller, more frequent meals instead of 3 big ones, and focus on soft, easily digestible foods. Chew your food thoroughly and consider sitting upright after meals to help your stomach empty more effectively. Most importantly, work with your healthcare provider to fine-tune your blood sugar management. While gastroparesis can be challenging, awareness and small steps can make all the difference in improving your comfort and control. Number 10. The next step. Now that you know the early signs of diabetes, what's the next step? It's simple but crucial. Get tested. The hemoglobin A1C test is the gold standard for checking your average blood sugar levels over the past 2 to 3 months. It's a reliable way to confirm if you have diabetes or pre-diabetes, and it's often the wake-up call many people need to take action. If you've noticed any of the signs we've covered, like frequent thirst, skin changes, or nerve issues, it's time to talk to your doctor about getting this test done. An A1C result of 6.5% or higher confirms diabetes, but even slightly elevated levels can signal pre-diabetes, giving you the chance to turn things around. Catching it early means you can make simple changes to your diet, activity levels, and lifestyle to protect your health for years to come. Remember, knowing is half the battle. Don't wait. Schedule the test. Take charge of your health and give yourself the best shot at staying ahead of diabetes. Recognizing the signs is just the beginning. Taking action is what truly makes the difference. Before making any changes to your diet, exercise routine, or lifestyle, always consult with your healthcare provider to ensure it's right for you. Your health and safety come first. Remember, catching these early signs of diabetes gives you the power to take control and protect your future. Small steps like eating healthier and staying active can make a big difference. If you found this video helpful, give it a thumbs up, subscribe to our channel, and hit the bell icon so you don't miss out on future health tips. Share your thoughts or questions in the comments below. God bless you and your family.